Hi, welcome everyone. Thanks for taking the time to join us in today's virtual pitching session. Today we have Qmed Asia that's currently raising 4 to 6 million ringgit on Leet Capital, our equity crowdfunding platform. So if you are interested to invest after today's pitching session, do head over to Leet.capital, or alternatively feel free to scan the QR code here as well. So before we get started, a quick intro about Leet Capital. So we are one of the 10 licensed ECF operators in Malaysia, and we are licensed by the Securities Commission. In fact, we are probably the newest guys on the block. We got our license in late 2019, and we started our operations in our platform in first quarter of 2020. Yeah. So we how we started was we were a technology accelerator, and we have been for the past 10 years. And we started investing in a lot of the startups that came out of this technology accelerators that we ran. And that's how our VC was born, 1337 Ventures, our early stage VC. And so to sort of complete or fill the ecosystem in terms of helping more later stage startups and SMEs fundraise, we applied for our ECF license, and that's why we say we are part of the 1337 ecosystem, helping entrepreneurs all the way at an ideation stage, all the way to when they need growth stage funding. So if you're new to ECF, you must be wondering what really is ECF or what is equity crowdfunding, right? So if you know how the funding ecosystem works in terms of private businesses, then you know that when a private company needs to go to investors, they normally go to, maybe 2, 3, or 4 angel investors, or maybe a couple of friends and family, or maybe some institutions as well, VCs as such, right? But the problem with this is it's very it has to be a substantial sum of investments from just a handful of investors, right? Just like in the diagram, as you can see on the screen. But with ECF, what we're saying is that we will now give your private business access to a wide range of investors, i.e. the public, right? So it's incorporating the Kickstarter model, the Indiegogo model of crowdfunding, together with the VC model of private investments. And so ECF sits in the middle, and it's a combination of those two models. So what are the benefits of ECF or equity crowdfunding, right? The first one is democratization. So we talk about how we're giving your private business access to a wide range of investors, i.e. the public. And this is our tagline in Leet Capital as well, right? We're looking to democratize funding, especially funding for private businesses. So now instead of just going to, VCs, banks, or a handful of angel investors, you get access to a wider pool of investors that can comprise even the angels and sophisticated, along with the retail investors. The second sort of benefit of ECFVC is high returns, right? The reason why it was only limited to more sophisticated or more high net worth individuals like your angels was because they were willing to take more risks, right? But I think as investors are becoming more financially literate and getting more awareness or education on investing in private businesses, there are more and more investors open to investing in private businesses. And so that's why there has been a rise in the number of ECF deals, but also the number of investors participating in ECF deals, right? So if you go and look at some of the reports published by Securities Commission on the landscape of ECF in particular, you will see that growth over the past couple of years. The third benefit of ECF is it's a great marketing tool, right? Probably the most beneficial aspect of ECF. It's a really great indirect marketing tool. Why we say this? It's because you can now get your loyal customers to now start investing in you, all your brand ambassadors, right? So people that have been using your product or your service for the past X amount of years, they can now invest in your business. If they're already using your product or service for some time now and they're so loyal to you, why would they not want to invest in you, right? So similarly, the other way around works as well, in terms of you can now get your new investors in your ECF campaign to be new users of your product or your service as well. And we've seen that with some of the past deals that we've done, right? Up to 40% of investors in the issuer actually became new customers of their product or their service, right? So it's a great marketing tool on both ways. And the final benefit of ECF, just to sum it all up, is you can now get investors that see eye to eye or understand your business, right? They believe in your product. You know, if let's say, you know, your local coffee shop is going to fundraise, right? And you've been going there for the past 5 years or so, and you love their coffee over there, I'm sure you'd want to be a part of their business as well, right? And so with ECF, the opportunity exists. You can invest in this kind of businesses. But there's more additional benefits that have come about for the past couple of years. The first one is the co-investment fund. So if you follow the budget commentary closely, you will see that the Ministry of Finance actually allocates a certain portion of the budget to ECF and P2P deals called alternative financing, right? So for MySIF, in ECF specifically, the government invests at a 1:4 ratio. What we mean by that is if the company raises 4 million from investors, the government will then co-invest at a 1 ringgit ratio, i.e. if they raise 4 million, the government will invest 1 million. So that's how the co-investment fund works. The second benefit is a tax incentive. So earlier this year, I think recently it got gazetted where investors that are now investing in ECF campaigns from 2021 up to 2023 are eligible for ECF tax incentives. So as long as you hold your entire investment for at least 2 years, you will be eligible for this tax incentive. There are a couple of guidelines or conditions for you to be eligible for this. You can have a look online, or alternatively, feel free to reach out to us. We'll send you some more information on whether you are eligible or not for this ECF tax incentive. And finally, potential perks. I think each ECF issuer or each ECF campaign is very unique in terms of the perks that they can provide to you. So we have Dr. Kev with us from QueueMed today. So they will talk about the perks, the incentives they're giving investors that are investing in their campaign. So how does ECF work really quickly? So the first thing that you want to do is you want to go to the respective platform and click on a campaign that you want to invest in. Once you do that, there's normally instructions on how to transfer your funds. We'll have a demo at the end of today's session as well. But normally you transfer your money to a trustee account. The reason why we do a trustee account is so that we don't use your funds, right? We safeguard your funds that is held by a specific trustee, which is required by regulations as well by Securities Commission. So if the campaign is successful, there's normally a 6 business day cooling down period, where if you do change your mind, because ECF campaigns can take up to 2 to 3 months, if you do change your mind, then you can ask for a refund. Maybe there's a certain, you have a personal matter, an emergency where you need a refund. That is possible in that 6 business day cooling down period, right? And so after that, what happens is then we just transfer the money once the 6 business day cool down period is over. In the instance that the campaign is not successful, then we will return the money to the investors. And that's why there's a minimum and a maximum target in ECF campaigns. So the company has to at least meet the minimum target for the campaign to be deemed successful. And so how does an ECF campaign work, right? If you've got a couple of hundred of investors. So we use something called a nominee structure. So as you can see, it's called 1337 Nominee Sendirian Berhad, which is our nominee company. It's a SPV that is set up by us. And so we manage all the couple of hundred investors in an ECF campaign, right? So whenever a company does reporting, they do it to us, and then we disseminate that information to all the individual shareholders through the platform. So there's a nominee agreement specifically for that as well. So if you have a Leet Capital account, if you go to QMed's page, you can have a look at some of their deal documents. There's a nominee agreement there as well, if you want to read some of the terms. And finally, this is how you get updated on QueueMed, as I mentioned earlier. So if there's any updates from the company, you'll receive it over here, right? So a couple of examples over here. There might be a quarterly updates, might be some budgets, or even annual audited accounts. All those kind of things you receive from your investor dashboard on Leet Capital. And with that, I think the intro is done. I will now pass it over to Dr. Kev, who will start his pitching session. So Dr. Kev, over to you.
Thanks. Thanks, Justin. Let me share my screen. Is everyone can see my screen?
Yep, all good.
Okay. Hi, good evening, everyone. So thanks for joining these sessions. So my name is Dr. Kev here. I see some of the familiar face over here. I see Dr. Florence here. I see Han Guang. So nice to catch up with you all again. So today I will be presenting about my company, Qmed Asia, our journey, and also our current equity crowdfunding through Leet Capital ECF platform. So first of all, for those who don't know me, I'm a medical doctor myself. Co-founded this company together with my partner. I will introduce. We have Dr. Tai, we have Nick Tai over here. So just before I'm going to proceed about my company, so I need to let you all know why we started this company at the first place. So we started this company around 5 years ago. And before this, I need to be honest, we didn't plan to venture into healthcare technology, this kind of sector. I myself is a medical doctor, practice in Hospital Selayang, then went to Hospital Bintulu for another 3 years. And then I come back to Hospital Sungai Buloh for another 2 years before I actually came out. So when I'm back in medical service at the time, I have 5 years experience on training in pediatrics. I entered master program, but I didn't continue. You can see from the pictures here, I have deep passionates in pediatric field. I love doing my clinical work back then. I also do a lot of journal article. I wrote few journal which published on international publications. But when I thought that my journey would become a pediatrician, but something happened back then in 2018, which is around 5 years ago, 4 to 5 years ago, where my daughter has some medical conditions by herself. So I needed to have quite a lot of time to spend to bring her for follow-up, for imaging, for DNA testing, for clinic follow-up. And that's the time that I decided to do something different. And I have a wife, also a pediatrician, and the time is also doing a master. So we can't afford to wait. I mean, we need more flexible time to take care of my daughter. That's the time that I decided to quit, and I decided to spend more time with my daughter to bring her for follow-up. And I get very dilemma at the time on what is my next career. And when I bring my daughter for a lot of follow-up in government clinics, government hospital, I think you all can feel me. I bring her for follow-up DNA testing in HKL, imaging in Selayang, then clinic follow-up in Sungai Buloh. Always there's a very long waiting time. 9 o'clock appointment, but when the time I see the doctors, even though it's my own colleagues, but it can take me 2 to 3 hours later on. So that is a time that I get very, very frustrated, because I experience from patient perspective this time. Before this, I always seeing healthcare from doctor perspective, and now I have the opportunity to see the healthcare industry from both the patients and doctors perspective. And that's the time I decided, together with my partner, we have Dr. Tai and Dr. Nick at the time, we want to do something for this healthcare ecosystem. And that's the time we started this company called QueueMed. We have the initial focus where we want to stop the long waiting time. We want to stop the patient's experience when they're seeking medical attentions. So that's why we started this company. And fast forward today, our company has been growing very tremendously. And we have rebranded our company to Qmed Asia because we don't just do queuing system. We don't just do appointment system. We do more than that. And we are rebranding to Qmed Asia because we also expanding to Southeast Asia market currently. So now I bring you to what is my company and what is my company doing and how I want you to involve in my journey to company IPO. So a summary again, our company is a healthcare technology company. We started this company to provide technology to help to bring this healthcare ecosystem more advanced, to provide more value to both the healthcare provider and also the patients. So when we started that time, we have nothing, but we are very proud that throughout this journey, we have been endorsed and recognized by a lot of our colleagues. We have been endorsed by Ministry of Health of Malaysia as the official partner. We've been helping them to implement our digital health solutions across nationwide clinical kesihatan, the government clinics. We have served more than 200 clinics and revamped their practice. And we also are very honored to be endorsed by Ministry of Science and Technology of Innovation, mostly Malaysia, to be their official partner. During the pandemic time, they came to us and we actually helped them to provide the solution for all the PPV center. We actually provided up to 42 PPV center, the crowd control system. And if any one of you have been to any PPV center will require a queue system, and that is the solution we provided for them. And not just the queue system, we also provide our clinical manpower. We help them to run the vaccination center up to 10 PPV at a time. And of course, we also been incorporated into MySejahtera app. So patients literally can use MySejahtera app. Even though it's not so relevant now, but back then it's very helpful because everyone will have MySejahtera in their app, in their phone. So literally, patient can use MySejahtera app to book appointment and queue online to the nearby clinics. So ultimately, I bring back to the main problem we want to solve in this healthcare industry. We started with we want to solve the patient experience because really that is my personal experience on very poor patient experience when we try to seek medical attention in government clinics, even in a private hospital as well. So second, moving forward, we also want to address more. When we have more demand, we actually see the market in a lot more pain point worth to be solved. Of course, these are the three things we want to solve: the accessibility, the affordability, and the patient experience in healthcare industry. So I don't want to expand more on this pain point. I think everyone feels the same. Accessibility, not enough clinics, not enough doctors due to the improper resource allocation. There is a lot of doctors in the Klang Valley, but in the rural area, there's literally not enough doctors, not enough clinics, not enough healthcare facility there. And the affordability, the cost of the healthcare is increasing year by year, 20%, almost up to 20%. So that is on the news everywhere. So why we think that three things is very important to solve, because that three things can bring a lot of implications. So one of the main implications is the raise of what we call NCD, non-communicable disease. So for example, the diabetes, the hypertension. Why is it so? So imagine you are the patient yourself. When you go see a doctors in the clinics or government clinics or government hospital or private clinics, that require you to queue for up to 3 hours or 4 hours. So after first follow-up, the second follow-up, you have quite a you are quite unlikely to go back to experience the same pain point again. So that lead to a lot poor follow-up of the patient and lead to the worsening of the NCD. Of course, the higher healthcare costs, the inaccessibility of the healthcare facility will further boost for the follow-up and early diagnosis of the healthcare diseases. So this is a very big burden. You can see that the recent article I'm not putting here, 9.65 billion on the annual spend on this non-communicable disease direct spending. So that is a huge market that we can tap on, and that is just the Malaysia market. In talking about Southeast Asia, that market is even much bigger. And of course, we understand to tackle all these complex issues, it involves a lot of stakeholders. It's not just the doctors or not just the hospital matters. It actually involves multiple stakeholders: healthcare provider, the patient themselves, the corporates, and especially the corporate employee wellness, and also the pharmaceutical company. And that's the time that we think that our solution need to expand. That's why we actually expand our solutions to tackle for different stakeholders using different solutions in the market. So let me go through individual solutions. So we have a solution for healthcare provider, patients, corporate, and pharmaceutical company. And if you are doctors yourself, so if you are my user, our company solution user, you understand these are the solutions we provide for you. We actually provide an online appointment system and mobile queue solution to help you to streamline your patient journey. And this is where we started on. We want to improve the patient experience when they come to see you. And from the pandemic time, we actually implement teleconsultation, where we allow patients to see doctors virtually using our solutions. And we think teleconsultation is not enough. That's why we actually bring in remote patient monitoring. Because teleconsultation, there is always these limitations that the doctors cannot monitor the patient vital signs. So that's why we introduce our solutions that we can allow the doctors to prescribe a step for the patients to bring back home, and patients can monitor their health vital, and the doctors will get a notification if any abnormal vital sign, and also can monitor real time and give a proper diagnosis from that. Of course, we'll come in with the patient health record consumer marketplace. And on top of that, we also putting in our solutions to help the doctors to provide more value-added solutions. For example, teleradiology. In teleradiology, is summarized, we allow the GP, the general practitioner doctors in the clinics, to do ultrasound or X-ray and get reported by the radiologist remotely. And we help them to implement this kind of digital solution. And there will be others coming in like telecardiology and teledermatology. So in a nutshell, we are helping the healthcare provider to improve their patient visiting experience, to automate their front door, and also to let them focus on more value-based care, and also we help them to diversify their revenue stream. So in terms of the digital solution for patient and consumer, we provide quite comprehensive from allow the patients to do teleconsultation with the doctors. We also provide home care services. We send our doctors, nurses to the patient home and to provide them at-home health screening, vaccination, even blood taking. And we're coming out with this personalized care plan to focus on those patients who have diabetic or even hypertension or heart disease. So we can provide them a very comprehensive, personalized care plan for them. So in terms of the corporate employee wellness, we recently launched this, what we call QueueMed Go. It is a mini clinic that we can set up in the factory, we can set up in the corporates, so the employee can literally see the doctors inside this small compound space. And with all the vital monitoring in place, they can monitor their vital sign and they can talk to doctors remotely using these teleconsultations. All the vital will be monitored by doctors real-time remotely, and doctors can arrange medication delivery, and all the patient health record can be stored both the doctor's dashboard and also to a patient portal. Of course, on top of that, we also provide 360 solutions, including what we call the on-site health screening program, on-site vaccination program, regular webinar to the corporates. So we have been implemented by quite a lot of corporates on our solution currently. So, and what's so special regarding our solutions here, you can see that because our company are founded by doctors ourselves, I myself and a group of doctors, so we see things as a doctor's perspective. That's why you can see our solution here is actually very comprehensive, very end-to-end. So before the patients, if you are a patient, before you come to the hospital or clinics, you can actually use our solutions to book appointment to the doctors. And if you want to reschedule, you can reschedule yourself. And on the appointment day itself, you will get another reminder to remind you not to forget your on your follow-up. And on the day itself, you will get an online queue ticket, so you can monitor your queue status using your mobile phone, so you can plan your journey accordingly. So you don't need to wait or waste your time over there. And after that, you can actually do teleconsultation with the doctors for the follow-up. And on top of that, you can also have the home vital monitoring, so that the doctors can understand you in a more deeper insight. So you can see that we're actually connecting the dots between the healthcare journey. And one more thing special about our solution here, we understand the healthcare is very complex. Not all the patients are very tech savvy in the market. That's why we make our solutions very all-to-all. Means like we have the online component, we also have the offline component tackle for both the different populations in the market. And that set us aside because we are not just focused on patient portal so much. We also have the integrated hardware IoT that we sell in the premise. And throughout these 4 years, we actually have been adopted and recognized by more than 200 clinic kesihatan, entire Selangor, Negeri Sembilan, even up to the Kelantan, Terengganu, Sabah, and using our solutions to improve their patient experience. You can see from the data there, before we implement our solutions, average patient waiting time is 2.5 hours. But now, those government clinics who implement our solutions, the waiting time average will be cutting down less than 30 minutes. So this is something we are very proud of. Of course, we also have a private partner. We have implemented for more than 200. Now it's actually close to more than 400 private centers nationwide. And these are the results that we achieved. Till that, we have more than 4,000 healthcare providers actively using our solutions. And we have more than 2 million of patients and customers served. And till that, we have actually have more than 11 million of unique booking transactions in our platform. And in terms of the Google trending, you can see patients actually search for us more than all our leading competitor in the market. You can see all this while people are searching when they want to search for help, they search for QueueMed in the Google trend here. So in terms of business model, because we have a different stakeholder, actually we have a different business model to tackle for different provider here. So for healthcare provider, we are mainly using SaaS model. We charge them subscription fee for using our solutions. And of course, in terms of the hospital projects, hospital we will actually have more customized project with them because we have to integrate with their HIS. So that's why we have a customized project fee for the hospital. And of course, we also do some of the digital marketing solution for the healthcare provider. And for patients, we are mainly using what we call the pay-per-use for their telehealth solutions, telehealth booking, home visit, home vaccinations, this kind of solutions. And for corporates, we are using SaaS model for the employee wellness program plus project fee. Sometimes they will ask for the on-site screening, and we charge them on this kind of project fee basis. And for the pharmaceutical company, we are actually working with AstraZeneca for the past 1.5 years already. We help them to do healthcare survey and data analytics, and we charge them on project fee basis. And also we help we also help healthcare pharmaceutical company to do the healthcare content and also education. So feel free to interrupt me if you want to understand more. So this is basically a summarize on our milestone, our journey. We started our company 4 years ago. When we started the time I mentioned earlier, we're focusing on tackling the long waiting time. That's why we come up with the online appointment and mobile queue solutions. But throughout the year, we have been requested by a lot of healthcare providers. I think there's few healthcare providers here, you understand. So they will give us a lot in feedback, and we actually listen and we implement the feedback into our solutions. That's why we actually expanding our digital health ecosystem. We have more than just online appointment and queue. We have more than that. And also we actually are doing our project on the mega PPV center, vaccination center. And this year we are very excited to announce that we are actually expanding our solutions to our regional market. So we have secured a deal with the Indonesia market. We're gonna implement our solution for hospital in Indonesia. And we are actually in the final stage to secure another hospital chain in Philippines to implement our solution in Philippines. And 2 weeks from now, we will be bringing our what we call the QM Go mini clinic solutions to Vietnam and also Cambodia market. And we are very aggressively expanding our solutions to regional market. And same time in Malaysia, we are working together with more hospital chain and clinic chain to expand our solution nationwide also. And moving forward, we are venturing to data analytics and more deep tech medical AI. Of course, there is a long topic. If you want to know more on the module that we actually planning for data analytics and medical AI, feel free to PM me, or we can share with you afterwards. Of course, ultimately, we plan to go IPO 3 to 4 years time. Thanks to our CFO, Wilson is planning all these things for us behind this. So in terms of financial performance, we actually break even currently in year 4. We actually break even after 2 years of incorporated of the company. And the latest financial year, we actually achieved a revenue of 12 million and currently profitable. And from the revenue, you can see the breakdown of the revenue is it's not just from single stream. We have a revenue coming from the clinical wing, where we provide all the patients or corporate solutions like home vaccination, screening, all these things. And we have the revenue coming from the provider, where we provide technology to hospital, to clinic, the queue system. And we have the revenue, of course, we have a PPV project contributing a portion of the revenue here. So in terms of revenue forecast, we are achieving a 12.4 million this last financial year, and we are very confident our next financial year will have a further growing to 13.5, and we plan to go IPO in 2025. Sorry. So this is my team here. This is a core member of my team. You can see we have Dr. Kev, Dr. Tai. We have combined experience of 15 years in this industry. Myself is a tertiary hospital, I mentioned before, hospital Sungai Buloh, Selayang, Bintulu, and Dr. Tai is coming from the primary care background. He's a hospital more KK Segamat, Qualitas group clinics before. So we have the deep understanding from primary care all the way to the tertiary care on how the healthcare actually running in the ecosystem here. Of course, we also have Dr. Sim in the company. Dr. Sim is our CMO. He also is an occupational health physician. She worked previously in the Babylon Health AI company. She is the Apex Clinical AI Researcher Lead in the Babylon. And I'm very glad to have her here. so that we can actually implement a lot of data analytics and also medical AI solutions together. Also, we have Leet Time, our CEO, previously coming from Capitals and also a serial entrepreneur here. And we have Wilson. Wilson is the chartered accountant, currently working with us on the chief financial officer. And also we have Dr. Eric. Dr. Eric is the consultant radiologist, but same time he also is a PhD in computer science. So that's why he has both the knowledge in terms of clinical and also technology. He's helping us in terms of the technology innovation part. So you can see from our company perspective, our strength here is we are very doctor centric. So we are medical in core. We understand from the doctor and from the healthcare perspective, what is the pain point and what is the solution needed to tackle in this field. Of course, we are also very digital driven, and also we can implement our solution very fast. So, and this is my team. You can see that we are all very passionate about healthcare. This is something we have in our core value here, because for us, healthcare is not a normal business. It involves a lot of patients, and it involves detailings, because healthcare data is very sensitive and healthcare is very different from other industry. That's why we put passionate about healthcare as our tagline, and this is our core value here. And on top of that, we also very agile. In terms of the business model, you can see that initially we only do appointment and queue, but when the pandemic came in, the time we quickly pivoted and we actually expanded our solution very fast, and we actually adapt to the market and listen to the market, and we adapt and come up with the solutions based on the market demand. And do you know that last year during the PPP time, we actually expand our team up to 500 people nationwide just to handle the PPP project. We have 10 PPP doing clinical service. We have 42 PPP doing the crowd control queue system nationwide. And we actually, one time, we have managed 500 people in our team here. 200 coming from the healthcare provider, another 3 coming from the managerial role here. So that is how agile is our company here. So you can see that in terms of the market, what we see in the market on healthcare fundraising, right? So you can see the famous name in the region would be Dr. Anyway. They actually raised quite a big check, 276 million last year during the pandemic time. And Speed Dog, also from Singapore, HomeGrown, they also raised quite a lot of big check over here. So in terms of the Malaysia market, Naluri, Helmetric, they raised 20 mil, 30 mil. And you can see Talk to Us. This is the recent news here. I'm not sure Dr. Paul is here or not. So Talk to Us seek to raise USD 8 million to 10 million for expansion. And this is this year, latest news. And Naluri, this is in their Series B. They actually raised 7 mil USD for their regional expansions. So you can see that healthcare technology sector is actually in the booming state. And in terms of the international market, so this is the latest news. You can see this is August 9. ByteDance, which is the mother company of TikTok, they bought over a China hospital chain for 1.5 billion. And in terms of Amazon, I think everybody know about Amazon. Amazon buy over a primary care company, One Medical, in a deal of 3.9 billion. And this is the news 3 weeks ago. So for our company, we are actually raising our pre-series A round. We are raising total of 10 million. As Justin mentioned earlier, this would be a combined investment, 4 to 6 mil coming from Equity Crowdfunding, and the rest will be coming from this institutional investor. So we actually have a few groups in talking. So that would be a core investment in this round. So for ECS round, we are seeking up to 6 million. So basically, this fund will be using for us to for our market expansion and team growth mainly, because we are actually expanding our solutions to Indonesia and Philippines. Of course, we also will be using 40% of our fund for our product development to upgrade our technology infrastructure, and 25% will be using for our marketing, for user acquisition, and also the partnership and promotion purposes. So we do have early bird rewards, because this is an ECF, so we can actually structure in a way that we can reward those who come in early. Currently, we launched after 3 days. We have allocated 500,000 in our company fundraising exercise. But for those who continue to raise the journey together with us, For those who raise 1 to 10 lots, you will get a complimentary of 5% bonus share. And those who raise 11 to 20 lot, they will get 8% of bonus share. And those who invest more than 20 lots, you will get a 10% bonus share. And that is not just it is. We also, on top of that, we also want to reward you all with our services. So if you are coming from individual retail investor, if you invest more than 3 lots, you will enjoy our home health services and also teleconsultation services complimentary. And if you are a healthcare provider yourself, so if you invest in us more than 7 lots, you'll get our solution for free for 1 year, and also 30% off on our registration kiosk, which I'll show you later on. And you're coming from the corporates, if you invest more than 13 slots, you will get on-site health service of 30% off and also 20% off on our telehealth kiosk. And this is how we want to reward those who believe in us and come to join our journey early. And throughout this journey, we have been recognized and awards by a few quite renowned program, etc. program, and we just recently got the Malaysia Award record. I think Bcash is here. We actually joined Bcash in this Magic Innovation and Healthcare Bootcamp in 2019. So we received quite a lot of guidance, and we actually received quite a lot of mentoring from Bcash. And throughout these 4 years, we actually got others rewards. And this year, we get invited by Bcash to join the Leet Capital's Capital ECF Accelerator, and we actually got our prize as top 1 winner. Thanks to Bcash for all this wealth guidance and mentoring. So I think that's my last slide.
While I walk you through the registration process and how you can invest in QueueMed if you are interested. Okay, how do you create an account on Leet Capital? So if you've not already created an account, go to leet.capital, click on sign in, and click on register account. Click I want to invest, and then fill in some details, some information. And then these are your personal details, and it's important for you to upload the front and back copies of your ICs as part of our KYC procedure. After that, you need to select the type of investor that you are. So we have 3 main types of investor: retail, angel, and sophisticated. So if you are selecting as angel or sophisticated investor, we do have to follow the guidelines that are given to us by Securities Commissions. So there are guidelines in terms of how do you classify yourself as those 2 investor types. You can have a look at some of the requirements over there, or even under our FAQ section, and we will need sort of proof or documentation to be uploaded before our team sort of verifies that. Once you agree to all of our terms and conditions, you are basically done, right? So this is your dashboard. This is where I mentioned earlier, this is where you get all your reports. You see where your outstanding investments are. If you have made any exits, this would be reflected here as well. And even your e-statement after you invest in a campaign, your digital share certificate, everything will be available from your investor dashboard. Right, so how do you get started in investing into a ECF campaign? Similar process, go to leet.capital, click on sign in, and then click on invest now. Find the campaign that you want to invest in. So in this instance, it's QueueMed. Click on more details, click on invest now, and then choose how many lots that you want. If you are a retail investor, there is a soft limit by the Securities Commission, which is at 5,000 ringgit. You can exceed that. It's just a soft limit, but you do have to sort of tick a checkbox and say that you agree that you are going above your soft limit. Again, this was just put into place so that we protect your interest as a retail investor. Once that's done, you will get a ref ID as well as instructions on how to make the transfer. So go to your respective online banking platforms, make the transfer to the respective account name, account number, and don't forget to put in the reference ID or the reference code in the description of your bank transfer, as we will need that to track your investments. And once that's done, our team will verify your investment within a couple of hours, and you will be notified via email, and you can sort of double confirm that in your dashboard as well. It should say your investment is verified. And that's pretty much how you invest in an ECF campaign and how you get your account verified.